Absolutely.
Now to the very latest on the coronavirus. Beaumont Health with an urgent alert tonight about a fourth surge of the virus. They do warn now is not the time to let your guard down.
I think it's an important time just to let everyone know that we've got to stay vigilant. We've got to continue to do all those things. There's very little that I can do here from inside of the hospital. This is really a community effort. Now that we're in a period of high transmission, we got to make sure we're wearing those masks. We got to make sure we're taking those precautions. We got to get ourselves vaccinated.
So if it seems like you're hearing about more and more people developing COVID despite being vaccinated, it's really not your imagination. But does that mean the vaccines aren't living up to their expectations? Dr. McGeorge is here now with a look at Michigan's current breakthrough rate. Doc?
Yeah, Sandra, vaccines aren't perfect, and even vaccinated people do become infected. But that does not mean the vaccines aren't still having an important effect. Here's the most recent data from the state. Between January 1st, roughly when vaccines became available, and October 26th, there have been 621,564 new COVID cases. 552,935 were in unvaccinated people, and 68,629 cases occurred in fully vaccinated people. So about 11% of the COVID cases since the start of the year are breakthrough cases. But that 11% is actually an average for the past 10 months. When you look at the percent of cases that were breakthrough cases since January, you can see at the start of the year they were very uncommon. But after June, the percentage of cases occurring in fully vaccinated people, the breakthroughs, has been running in the mid-20% range. And when you similarly look at breakthrough hospitalizations and deaths, you see exactly the same trend. So it's not your imagination. There has been an increase in the percentage of cases, hospitalizations, and deaths since the summer. But the breakthrough data does show the vaccines are working. For example, in October, when 27% of the new cases were breakthroughs, 73% of the cases were in the unvaccinated. And when you do the math accounting for the fact that there are more vaccinated people in the state than unvaccinated, in the time from January 1st to October 26th, an unvaccinated person was 13 times more likely to become infected or die from COVID-19. Now, another critical piece of information is that people over 65 are far more likely to die from a breakthrough infection. Of the 793 breakthrough deaths since January 1st, 699, that is 88% of the breakthroughs, were in people 65 or older.
Yeah, and Doc, it just makes you wonder, what do these numbers mean if you're vaccinated? I mean, do we need to worry?
Well, Sandra, I wouldn't say worry. The vaccine is doing its job. But as we knew from the beginning, it is not a 100% guarantee. This is part of the reason that, especially for older people or anyone with other high-risk conditions, a booster is recommended along with masking and precautions when appropriate.
Yeah, obviously we still have to take all of those means necessary. All right, thank you so much, Doc.